Hi everyone, Jennifer Blevin Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about the importance of performing cost analysis in regular intervals in your practice. Performing cost analysis ever so often on a regular cadence is super important for the bottom line of your practice. This isn't just talking about your inventory and how much you're paying for medications, vaccines, supplies. However, that is amazing that you do that and you should be doing that, but it goes a little bit deeper than that. But let's first talk about the cost analysis for the medical supplies, the vaccines, the medications. One of the things people really need to consider when they're doing a cost analysis fully, right? You're not only looking about how much you're paying out of pocket per dose or per item, you're also going to be looking at how it costs as a whole to perform a service. So maybe a laceration repair. You need to look at the cost of everything together. So all of the supplies you would be using, if you use a lot of disposable supplies, how much it is per supply, and about roughly how much you use per service, right? Of course, that's going to be a little bit difficult when it comes to like how much gauze that you use or bandaging equipment, but what about your actual sutures? What about the tools? Do you autoclave them and clean them, or do you buy disposable ones and buy new ones all the time? How much does it cost to run the autoclave? How much does it cost for the supplies of the autoclave? Making sure you're doing your autoclave spore tests as often as you need to, the calibrations, considering all of the costs that go into using your autoclave machine, right? And then looking at the amount of medication that you use, right? The lidocaine to numb it up, things like that. So you're going to look and see how much it costs as a whole, if you, to the best estimation you can, of how much it costs to offer that service, because then you're also going to be taking that to see how much you get reimbursed for that service, because that's how you're going to know about how much it costs you out of pocket just for supplies to offer that service. Depending on which specialty you're in, there are going to be some services that you have to offer. If you're in urgent care, you have to offer a laceration repair or a family practice. But maybe you're in a specialty where you're offering some services that you don't have to. And if you're not going to be making money and you're going to be losing money, especially, you might reconsider whether you offer that service or not. Again, we're just talking about supplies right now. We're not taking into consideration the staff time, which will be something we talk about in just a second. So when you're doing this cost analysis, you need to know how much you pay per unit. You need to know how much you're getting reimbursed for the CPT codes affiliated with those services or with that supply, right? If it's a medication and you bill that individually, like ketorolac or trimethazine or Zofran, something like that, how much are you paying per dose and how much are you getting reimbursed per dose? And you need to make sure for those medications that you're looking at how much you get reimbursed per unit. Because most medications, not vaccines, medications are reimbursed per milligram or per milliliter. You have to read the HCPCS definition for the CPT code to figure out how much is a unit for billing reasons, not NDC units, billing units. How much is a billing unit? Then you figure out how much is a dose. And sometimes, a lot of times, medications might have multiple doses, like Rocephin, right? You have a 250, 500, 1000, and you need to figure out how much it costs you to buy a 250 milligram vial of Rocephin, and then how much you get reimbursed per unit of Rocephin, which Rocephin is reimbursed every 250 milligrams. So how much does it cost you to pay for a 250 milligram vial? How much does it cost you to pay for a 500 milligram vial and a 1 gram? And then how much do you get reimbursed from your highest payer and your lowest payer, because then everything else will be in between. So you can look at that. So medications, very important to make sure that you're looking at your reimbursement per unit and considering how many units is a standard dose in your practice. Vaccines are a little bit easier. However, I have had many contracts with certain insurances where their reimbursement doesn't even cover my out of pocket cost for one dose. So their reimbursement for one dose is less than what I pay for one dose out of pocket. And it wasn't worth it financially for us, especially as a startup, to offer that vaccine. So we had a policy internally that if a patient needed this specific vaccine and they were insured with this specific insurance, we would have to send them to the pharmacy to get it. There are also situations, of course, where Medicare will only cover certain vaccines at the pharmacy and vice versa. So you have to take that in consideration when you're looking at your cost analysis of how much it costs you, but do you give it to all patients with all insurances? Are there certain insurances that you shouldn't factor in the cost analysis because you always send them, refer them to the pharmacy or somewhere else to get that medication or supply or vaccine because it isn't reimbursed on their plans in the office? There's a lot that goes into this. It's not just as simple as saying, oh, we pay this much for this and we get paid this much from the insurance company to reimburse for that and we're good. No. Now I want to talk about the additional factor of the staff time of using that medication, that supply, offering that service. Think of it as like a bundling, right? So you have this amount of supplies you use for laceration, but it takes this much time of the doctor's time or the provider. Plus, you have the assistant, which is a medical assistant or a nurse, also assisting on that procedure. And you have to figure out about how much time each person who is involved is spending on it, taking their wages, dividing it. What's the average wage you pay for that position? You don't have to get as specific as each person, but an average is very fair, and figuring that out into the total cost of offering that service. One cost analysis that a lot of people fail to look at when they're doing this in their business is the staff time in general. How much are you paying from your overheads in just staff wages, in their taxes that you have to pay as an employer, for their benefits that you pay a portion of? Anything that you have to pay for an employee when it comes to their wages has to be factored into an overall cost analysis. The largest piece of this is overtime. How much are you paying a month in overtime wages? Is it necessary? Do you have a policy where it needs to be approved first before someone works overtime? Why are certain people possibly having more overtime than others in the same roles? Why is it consistently there is so much overtime? Because you pay more out of overtime and it is expensive. It's time and a half or double, whatever your policy is. And that adds up very, very quickly. So someone needs to be looking at this and going, okay, why is so-and-so constantly having overtime, but this other person is short their 40 hours a week or 80 hours on their pay period? Something's not right here. Something needs to be balanced out. I need to look into this further. Or why is this person seem to constantly have overtime and nobody else in the practice does? Are they not using their time wisely? Are they milking the clock because they want that extra overtime? Do you need to readjust everybody's schedule so it pads it a little bit, so even if they work a little longer on certain days, it doesn't go into overtime? Some states like California, overtime is calculated after 8 hours per working day, where most of the country, it's over 40 hours in a work week. But you need to know what your guidelines are, which I'm sure you do, so that you can make the appropriate adjustments where needed to try to avoid as much overtime as possible. Another area to be looking at for cost analysis closely are third-party vendors. Are you hiring out for services that you could possibly bring in-house? Certain times it's appropriate to outsource because you don't have the manpower, you don't have the time, the bandwidth. And as you grow and you might get more staff in and maybe they don't have as much on their plate, you have someone that could learn how to do a certain skill or monitor certain things? Or are they hired to be able to complement that and can take on a little bit extra responsibility? Also, shopping around to see if you can find vendors that are a little bit more affordable or price things a different way that maybe you wouldn't have to pay as much because what you require for your practice is different than what somebody else might have to. So it's more of like a customized pricing instead of how they charge across the board. We get comfortable with the vendors that we've hired, that we've had for a long time. And this is something that a lot of people just go, I like them, I trust them, it's worth the money. I don't want to put in the headache of searching around and looking for other places or other vendors. And that's fine if that's your choice. However, you have to remember whether you're a medicine or any other kind of line of business, it's still a business. And your goal should be to make as high a profit as possible. And to be able to do that is making sure you're spending your money wisely. Third party vendors can be costly and they can add up. Are you putting the money where it's worth it? And then are there opportunities where you could bring things in house and give it to someone else who you would pay a little less or it would cost less to do it in house? You can monitor it more closely. You can have a little bit more control on it, possibly. Other factors to consider in this as well. For the practices, specialties that have a lot of medical specialized equipment, are you purchasing or are you leasing? Is it worthwhile to actually outright buy that piece of equipment than to continually lease it? Do you get a return on investment by buying it, or is it not worth purchasing and you just can keep leasing and that's fine? Sometimes we don't know what we don't know. So you buy something outright, but it gets outdated really quickly and you end up having to buy a new one out of pocket in a year or two. And you're like, ugh, I wish I would have just leased from the beginning, but I didn't know that was an option, or vice versa. You're leasing something that's very costly and you could outright purchase it where yes, the money up front is going to be, maybe a tough pill to swallow, but in the long term, it pays for itself and then some. These are things to be looking at. EKG machines, um, peak flow spirometers. There are multiple things that we've come across in practices where they have leased it or they have bought it and it gets outdated quickly and they have to buy a new one. I've seen both sides. It's one of those things where you have to consider what it is, how often you use it, what's the reimbursement, and go from there. But it's definitely something that needs to be looked at. And like I said, we get comfortable in what we've done or what we're doing, and we don't think about maybe that's not the best way, and just to look at it again to see if there's a different option out there that might work better. My last thing is about your actual physical clinic space. Most people lease, and I understand. However, would it be an investment to purchase a building where you can have tenants of other specialties that can help pay the rent to you to help pay your bill of mortgage for the building? Will it be a return on investment? Is it a very high sought after area where other businesses, maybe not even necessarily medical businesses, would want to be in that building in other suites that might be present? Or even if it's only one clinic space, like there's no other suites, could you have a subspecialty come in once or twice a week that could pay rent and see patients that you refer to them and they get outside referrals? Maybe a mental health counselor could come in and rent a space from you. Being a little bit savvy when it comes to being kind of an entrepreneur and seeing if it is worth purchasing the space so that it really is an investment and then you're not just paying someone else's mortgage, right? Cost analysis, not just looking at what you're paying for something and how much you get reimbursed, but really doing a deep dive. I think it should be done at least once a year, if not twice a year. Depends on your specialty, your costs, your overheads, the amount of staff you have. There are a lot of factors, but this is something that should be looked at. And You should have a list of all of the things that are analyzed in this cost analysis so that you do it consistently and compare apples to apples every time so that you have a very solid comparison. And I know that your bookkeeper, your accountant, anybody who is going to be involved with the business, if you were to sell it someday, would appreciate seeing the history of that as well. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with anybody whom you feel would benefit. We'll see you next time, and we'll talk to you soon. Bye-bye.